Let's talk about cancer. Right now, cancer is perhaps the leading issue within the United States. Back in the early 1900s, the incidence of cancer was about 4%. Today, it affects about 50% of the American population. So if there's someone next to you on either side, if you look at him or her on both sides, one of those two people is going to get cancer. And if any of those two people looked at you, you have an equal chance of getting cancer. So 50% of the population is affected with cancer, which means 100% of the population within America will be affected either directly or indirectly through extended families, friends, and colleagues, and exposed to that dreaded six-letter word called cancer. So what is cancer? Because the one thing oncology doesn't do is address why I got cancer. One of the answers that everybody likes is genetics. Well, let me just pop that bubble. If you are genetically predisposed to having cancer, then there's nothing we can do as far as medicine is concerned, in my opinion, to help you. Why? Because every cell in your body has the same gene sequence, and you have these things called stem cells, and these stem cells can convert themselves into any cell. So no matter how much surgery you try, you cannot eradicate every possible cell that has that genome and that expression of the genome. So genetics account for very few percentages, thank God, of all the cancers, in my opinion. So if genetics is not the wastebasket for cancer, then what is? Well, interestingly enough, in my experience and in my opinion, 85% of all cancers start with either dental toxins in the form of root canals or extracted teeth that have become cavitated. Let's talk about root canals for a moment. What is a root canal? A root canal is when the dentist removes the blood supply and the nerve supply to a root. In essence, what is left behind is dead tissue. The dental dogma is, let's save the tooth at all cost. So the best way to explain what a root canal is, at least to me, is as follows. Someone has an appendix that needs to be removed. The surgeon removes it from the cecum where it's usually found, sutures up the cecum, takes the appendix, but instead of taking it outside the body, leaves it inside the abdominal cavity. Why? Because it belongs to the patient. So the surgeon leaves it there because he wants the patient to die with all the body parts intact. If he did that, most likely the patient will develop an infection in his belly called peritonitis, be deathly ill at best, at worst would die. And it would be seen as malpractice because we know that infected dead tissue should not be left in the body cavity. Well, the root canal has no blood supply, no nerve supply. In essence, what the root canal does is kill the tooth, and we choose to leave it inside the body cavity. There's a gentleman named Weston Price who lived in the early 1900s. Dr. Price was a dentist who studied root canals for 20 years. He noticed that people who had root canals often had chronic illnesses. And moreover, when he removed the root canal, he noticed that the chronic illness became better. Dentists have followed Dr. Price's work and in fact have come up with tooth charts, which will be presented in this video, that connect each of the teeth in our mouth with different organs and with different chakras and with different elements of the human body. It's odd, having been trained in a traditional school, that we never really discuss teeth except to acknowledge the fact that there's a jawbone and that there's teeth in the jawbone usually, and that when there are problems they should be referred to the dentist. But we don't connect the fact that the teeth can affect the entire corpus, the body, and they do. So Bill Henderson and I have found a group of biological dentists that understand the work of Weston Price, who believe that Mr. Price is correct, or excuse me, Dr. Price is correct, and help patients who otherwise cannot have root canal teeth extracted because the dentist refused to do it. We're not interested in blame. We're interested in resolutions. Let me share a story for a second. There's a lady who moved from Tennessee to Florida, and before she left Tennessee, she had a root canal. She then developed kidney issues, was treated in Tennessee, moved to Florida, and came to see me because, well, her renal function was deteriorating. She saw a nephrologist or a kidney doctor down here in Florida, and he was told, or she was told, excuse me, that there was no remedy for the problem. I sat down and took a history and I listened to what they had to say. And I said, so you were healthy until you had the root canal? He goes, yes. I says, have you ever contemplated that the fact that the root canal might be the responsible agent or the causative agent for your renal failure? She thought about it and said, well, that's the only difference, but I went to the nephrologist, and the nephrologist said, you know, we don't know why it's caused. So I recommended that she have the tooth extracted. She went back to her nephrologist, thought I was crazy. Not the first person to think I'm a bit cuckoo, but hey, you know, won't be the last either. At any rate, eventually her renal function deteriorated. She came back. I recommended that she have the tooth extracted, and it was. When her tooth was extracted, her renal function miraculously started to return to normal and is currently having normal renal function. We're not interested in blaming people. We're interested in providing you with good health care. We're not interested in just treating the symptoms. We want to get to the root cause of what the disease is. So if you have cancer, one of the things we need to evaluate, one of the things you want me to evaluate, is whether you have root canal teeth, have them extracted because that's the safe course of action, and provide you with options for cosmetic repair thereafter. Now, assuming you don't have root canals, because not everybody with cancer has root canals, then we need to rely on the work of a doctor named Hammer. Dr. Hammer is a German oncologist, and the gist of his work is as follows. He asked 1,500 patients with different cancers to have a brain scan, and they did. They all had a structural abnormality. He noticed that 85% of the time, a location of this structural abnormality in the brain corresponded with a specific body part having cancer. He then quizzed all 1,500 patients and collated the answers based on what body part first presented with cancer. So we had a breast cancer pile, liver cancer pile, lung cancer pile, and so forth. He then read the answers and he found some very interesting similarities in their answers. People who present initially with a head, neck, or lung cancer perceive that when they give an opinion, it is either disrespected, ignored, or challenged. People who present with breast, ovarian, uterine, cervical, vaginal, testicular, penile, and some prostate cancers perceive a betrayal by a loved one, whether it be a grandparent or a parent or a spouse or a child or a grandchild or a close friend or relative or colleague, or they were caregivers and someone under their care died. If it involves the right side of the body, based on Chinese medicine, it usually involves a male figure in their life. If it's the left side of the body, it's usually a female figure. If someone has esophageal, stomach, GI, colon, colorectal, rectal, bladder, kidney, and the other aspects of prostate cancer, they may feel that they're trapped in a life with few options, such as, I hate my job, I hate my boss, but it's the only employer that pays the kind of money I want to make in this area. Or I hate my home life, but I have 25 kids and a wife and I cannot afford the child support and alimony. People with musculoskeletal cancers feel they have the weight of the world on their shoulders. Liver cancer tends to hold on to negativity, to anger. These are people who remember angry issues, angry encounters for years on end. Pancreatic cancers feel that they've been publicly disrespected or humiliated. So what we do here at Utopia is we have a psychologist, after you fill out an extensive psychological evaluation sheet, who evaluates any psychological issue, whether it happened in your childhood or your teenage years or your young adult or older adult life. According to Dr. Hammer, the more serious the event, the death of a child, death of a loved one, the closer the incident is to the onset of clinical cancer. The more insidious, the less severe the issue, the further it expands out to 3 years before you've been evaluated with cancer or diagnosed with cancer. So people need to understand that the emotional aspects of cancer are present, and that potentially the mouth pathology in the form of root canals or teeth that have become cavitated or abscessed also play a role in depressing the immune system, which facilitates the onset and the presentment of what we call clinical cancer. Because I believe that every one of us is challenged by the cancer viruses every day, and our immune system steps up to the plate to keep us healthy. And that's what the immune system is supposed to do. So, treating cancer is a whole different series of events. Treating cancer has numerous options. When you go to traditional doctors, they will offer you chemo, radiation, and surgery. Depending on where your cancer is and other variables, all 3 may apply, or 2 may apply, or 1 may apply. Here at Utopia, we believe that the only person who can cure you of cancer is you through your immune system. Whereas chemotherapy, in my opinion, does a wonderful and a masterful job of destroying your immune system, we at Utopia, I believe, do a masterful job of empowering your immune system to rear its beautiful head and go after what we call cancer to bring you back to ease and health. In order to do that, we need to again empower you to understand that you are your healer, that we are here to teach you how to heal yourself, because doctors cannot cure you. Please understand that. The medical model says, use it, abuse it, break it. The doctor will come up with a pill or a procedure so you're not responsible. At Utopia, we tell you you are responsible because you've made bad choices. But you can change the choices you've made. You have that power. You have the power of healing yourself. You just have been brainwashed into believing that you cannot. But we know better. We know that you can. And in fact, when doctors try to play God, when doctors tell you that you've got X amount of time left, what they do is they undermine your ability to believe. They undermine hope. They undermine dreaming that you can be well. Because without hope, you are totally hopeless and you will fail. So when a doctor gives you a shelf life, in my opinion, he's done the worst thing possible, because we are not gods. I don't care where you reside. I don't care how big your office is. I don't care how much wallpaper you have on the wall. I don't really care who kisses your ass. The reality is we put our pants on one leg at a time. We bleed like you. We think like you. We are as smart as you. We are as dumb as you. We're no better. We're not gods. You are the one who can cure yourself. That's what real medicine's all about. What a physician does is change the balance of pH, gets you to eat healthy because nutrition matters, contrary to what traditional doctors like to believe. Get you to oxygenate your body because oxygenation is key. Otto Warburg proved that 100 years ago, showing that when cancer cells are presented with oxygen, they either revert back to normal or they die. We figure out why it is you decided to allow cancer to thrive, because it is your choice. And you want it to be your choice. Because if you chose it, you can unchoose it. People are usually repulsed when I tell them that cancer resulted because of your choices. They don't see what that statement really means. That statement means you're in control of the outcome. Because if you're not in control of your health, then who is? The doctors will hook you up to chemotherapy, and it'll work. in less than 3% of the time, according to the literature that I've read. Medicine will try to tell you, oh, we'll do it this way and that way, and we got new drugs, and it's all target specific. We don't have anything that's target specific. Because the reality, the sad reality, is that if we were to come up with a cure for cancer, the American economy would take a devastating financial hit. Unemployment would go through the roof. That's the sad truth. But that's not why I went to medical school. That's not why I became a physician. I went to medical school, I became a physician to try to help people heal. And then somebody else will come up with a model that will work for the economy. When the internet came out, everyone was assuming doom and gloom back in the early 70s, only to find out that the internet has employed more people than anyone ever thought possible. The same thing here. We will survive with people getting well. I want to help bring healthcare to America. What we have, in my opinion, is sick care. We treat the symptoms, make you feel better, while keeping you ill. That's not medicine for me anymore. It was at one time, I'll be honest with you, because I was brainwashed, just like everybody else. But I have no problems telling you that the king has no clothes, because he's nude. But you have the power to heal. Our job is to teach you. Your job is to learn. Your job is to believe in you and your immune system, and we have the tools at Utopia to help you do that. Now, for those of you who are diagnosed with cancer, you can call Utopia, and you'll see the telephone number for Utopia on the screen in a minute, and you can make an appointment to talk to me for free. We'll go over your case. We'll give you options. You can decide what you want to do, because remember, if you don't make a choice, you have made a choice. Not to decide is a decision. So when you leave it in the doctor's hands and you don't participate, that fellow better be God. So, cancer is a serious issue. Feel free to call my office and speak with me, make an appointment. I don't charge you for that. Understand your options and then make your choice. If you understand your options and you choose chemo, radiation, and surgery, I will respect your choice because it is your body. And it does work in less than 3% of the time. If you choose to go on your own path and figure out how to take stewardship of your health care, then perhaps Utopia is the right place for you. At any rate, I wish you well. Please get happy. Happy people don't get sick. And once you get happy, stay happy.